Okay, and what are we looking for, guys? I'm going to start with all the joints here, okay? No abnormalities noted. Joints are not swollen or tender, because the patient will tell you if they're having joint pain, you know, once you start palpating, it'll hurt.
Range of motion, hands, arms, and shoulder.
Okay, so hands, you would have them do this. Okay, and what else? Arms?
Arms.
Okay, you just have them flex and bend. Just have them go up, however you want, and then shoulders. Have them go up and down, or have them go in circular motion. And all you have to say is range of motion intact. Okay.
Range of motion of legs and hips.
Okay. So the legs, you can have them either have them go ahead and move their foot up and down, or I like to have them lift their knee up. Okay. And then what did you say? The hips, right?
Hips.
So what I want you guys to do, what they did in the video was just this, but what I want you guys to be able to do is just have them go out a little bit. Make sure that this actually bends out. If your partner can't do that, then just show me what you would do, okay? And then what you can say is range of motion to legs and hip intact. Okay, what else?
Palpate knees and ankles.
Palpate knees and ankles, okay. What you do is you take the knee and you palpate around. And what are you looking for? Fluid, swelling. Okay. No tenderness, swelling, or fluid noted. Okay. Ankle, same thing. You're going to be checking for fluid, tenderness, any abnormalities. People who have fractured their ankles will be very deformed. You'll see either area will be very protruding. So you can either say this thing's squeaking, huh? No abnormalities noted, no swelling, tenderness.
Okay, check popliteal, posterior tibia, and dorsal pedis pulses.
Okay. So you're going to have your partner bend the knee, and like they showed you in the video, stabilize with your knees here, and you're going to be digging with these fingers in here, either 2 or 3. Okay, and that's the technique. You may not be able to feel it, but that's how you should be doing. And it's easier to check on a child if you have a child at home or somebody who's fairly thinner. You're going to be able to feel it.
So you're supposed to be where? Where are you supposed to feel it?
Underneath
Oh,
your
underneath.
underneath your knee.
Oh, yeah.
That's what I was telling you.
Underneath.
Somebody was trying to feel the pulse up here. That's that's not right. It's you bend the knee, you stabilize the knee with your thumbs,
Okay.
and you dig in underneath it.
Underneath.
Yes, because you'll be able to do it on a real knee.
Oh.
Okay.
Posterior tibial.
Okay. Where's the posterior tibial, you guys?
Tibia. Tibia. Tibia.
Posterior tibialis. It's on the inner aspect of your ankle. Okay. And usually you're going to feel around here. Sometimes people's locations are different. Sometimes they're up here. Sometimes they're down further.
Dorsal.
And when do you actually check for pulses that far?
For vascular disease.
People with arterial disease, especially in the cath lab when they've had a post-cath. We check those, like I told you guys, every 5 minutes if they're under anesthesia, every 15 minutes if they're not, if they just got unconscious sedation. So we're checking both the posterior tibialis as well as the dorsal pedis to make sure their circulation hasn't been occluded or compromised. And usually it's very hard to find the pedal pulses on people. A trick that you can do is follow the bone that goes down here. And sometimes you'll find it. Other times you go from the toe up. Okay.
Check range of motion of spine and evaluate normal spine curvature.
Okay. So you're going to have your partner bend over. You're going to run your fingers down their spine. You're going to say spine intact, curvature within normal limits. Or you can say no abnormalities in spinal formation. And then what you're going to have them do is just have them lean forward while you're inspecting it, and then go back, side to side, and then backwards. Okay.
Inspection of symmetry of hips, shoulders, and scapulae.
Okay. So while you're actually have them down, laying down is when you're going to have to check for symmetry of the hips. And then what else? Shoulders?
shoulders.
Okay, so you can do it while they're up here, the shoulders, or you can do it while you're checking their spine, okay, when you have them standing up. And then what else?
Scapula.
And then scapula. So what you're going to say is scapula intact and symmetrical, okay, because basically what you're checking for, let me use it if you don't mind, is making sure that this is in alignment, okay? The shoulders are in alignment, not that one's higher than the other, okay? And then the hips, you can either do it from the back or when you're actually checking the hip. Is that it? Okay, any questions?